Well, according to the American Cancer Society, 1 in 8 women in the United States will develop breast cancer in her lifetime. October, of course, is Breast Cancer Awareness Month. You've seen the skyline lit up pink. Here's a look at it from around 3 o'clock this morning. And there have already been a handful of fundraisers held here in the Queen City in the last week or so, with many more scheduled. The goal to raise money for research and bring awareness. Joining us live to talk about this is Dr. Lori Gentile. She's a breast surgical oncologist at Novant Health. Thank you so much for being here with us.
Thank you for having me this morning, Chloe.
So we know that this is one of the most common cancers in women. So when should we start screening, and what does that screening look like?
So breast cancer screening is really important because, as you mentioned, 1 in 8 women will get diagnosed with breast cancer over her lifetime. Fortunately, we have fantastic screening tools for detecting breast cancer at early stages, oftentimes before women can feel anything or notice a change on the outside of their breast. And so screening mammograms are the most common tool that is used, which is essentially an X-ray of the breast that is taken. And cancers found using a screening mammogram annually or 1 time per year are much, much smaller in earlier stages than when women find them from just looking or feeling the breasts alone.
And what are some of the advances in mammograms?
So some of the advances in mammograms or new to the scene in mammography is something called 3D breast tomosynthesis. And what most women have heard is the term 3D mammogram. And so that has been FDA approved actually back since 2011 and is almost exclusively used for breast cancer screening these days, particularly in women who have dense breasts as well. The goal, or what studies have shown us about 3D mammograms, is that they have improved detection rates for cancer, or they are better at finding cancers, and they actually will lower the rates of false alarms, or what we call false positives. And that's where women would have to be called back for additional testing when really everything is okay.
Getting a diagnosis, obviously very scary, very overwhelming. So what is the cure rate for breast cancer?
So fortunately, cure rates for breast cancer are very good and very high. With all the fundraisers that you mentioned and all the awareness that goes on with women with breast cancer, this being the most common cancer diagnosed in women, there's lots of research and lots of advances that have been made over the years. This kind of ties back into that screening mammogram and finding cancer at early stages. The 5-year survival rates are really as high as 98 to 99%. So most women who find cancer at an early stage do really excellent. All of this research has led to more targeted treatments and genomic testing, where we're really able to tailor and personalize a woman's breast cancer care, and women do really, really well when breast cancer is caught at an early stage these days.
And last question for you, what are some of the advances in surgery techniques?
So surgery has also come a long way. 40 to 50 years ago, women who were diagnosed with breast cancer had to undergo what we call radical mastectomies, and that's the removal of all of the breast, some of the muscles of the chest wall, and all of the lymph nodes in the armpit. And today, in modern care, the vast majority of women diagnosed with breast cancer, about 65 to 70%, actually are able to preserve the breast in what we call breast conservation treatment, where they just have a small surgery, which is called a lumpectomy, and we remove just the small tumor in the breast, and we assess the lymph nodes using a targeted technique. Many breast surgeons, like myself, are trained in using techniques where we're able to hide the scars, and we use techniques to minimize any deformities or changes to the breast from our surgery. If women do need a mastectomy for their treatment, which is the removal of the entire breast, we work along with plastic surgeons these days, and we're able to have multiple advanced reconstructive techniques where we're able to reconstruct and rebuild the breast after surgery.
Really, really important information. Thank you so much for being here with us this morning, Dr. Gentile.
You're welcome. I appreciate you having me.
Thank you.